So, good afternoon, everyone. This event is all about creating a picture of digital support for health and wellbeing in Leeds. Habitat and Leeds City Digital Team go back a long way, and we've done a number of projects to get the best out of digital for the citizens of Leeds in a health and care context. And I'm really delighted to be able to host this event today with Alistair Cartwright, who is the director of the city's integrated health and care digital programme. I doubt that there is anyone in the city who knows more about this subject in Leeds, and I'm really looking forward to learning more myself today. One thing is for sure, that there is an incredible amount of activity going on, and never has it been more important. So to support citizens to thrive in an uncertain and economically, socially and environmentally really tough environment, and to provide access and effective health and care services is absolutely vital, but it's also really hard. As a relative newbie to Leeds, I've been absolutely bowled over by the sheer amount of activity and energy going into this area. But more importantly, the will to make the most of all our resources to hand to work collectively alongside citizens to co-design the best possible digitally enabled health and care system which works for everyone. So, with no further delay, I'm going to stop sharing my screen and hand over to Alistair to take us through the day.
Thank you, Rose. Nice to see some of you and see some names. Some names I'm familiar with, so it's good for you to be part of our session this afternoon. So just to go through what the plan is, we are wanting this to be a co-production session. So first 30 minutes is us giving you something as the audience in terms of telling you a bit about our plans as a city, how we are creating digital facilities to support improved health and well-being. The next part will be moving into 2 breakout rooms, and what we're really keen to do is get your contribution to an idea that we've got around representing the things we're doing through a you might call it an infographic. At the moment, you might just call it a very poorly drawn picture, but the idea is that we want to come up with a product that represents what we're doing in the world of improved health and well-being through digital. We want to ensure that we've got the language right, the graphics mean something, the concepts right, and it is absolutely, your chance there to contribute to hopefully something that we'll use across the city for as long as it feels relevant. So I do have some slides. It's always that slight risk when you put your slides on that I'll now lose contact with people's faces. There will be, even in this first session, I'm going to ask for a little bit of input, so don't be shy about when asked, unmuting and just giving me a quick view on some of the things we're going to be talking about. So, all right, just to check that you can actually see that slide. So if you want to, good. I've had a nod from somebody. That's good. I've worked out how to look at half a slide. Oh, thank you for the thumbs up as well. Half a slide and half a screen full of people's cameras. So that's great. So we have called it, well, I'll just have to make sure I can see all the slide now, creating a picture. So it is about the power of pictures in terms of putting across a story. But we do know that everybody, you read a picture differently. People have different views on what that story is. So it's no mean task to create a picture that might represent digital's support for improved health and well-being across the city. But that's what we're going to try and do this afternoon. So I'm joined by 2 colleagues, Natasha, who's our senior comms lead, and Toby, who's what's called an architect, not in the house and buildings area, but a digital architect. So we'll be joining the breakout rooms as we go through. So there we go. The power of a picture. Now, interestingly, we often use this PowerPoint backdrop to, you know, it's almost just there as it feels comfortable, it's quite colourful, but actually any picture has been created with a purpose, and hopefully you will notice that this PowerPoint backdrop is there to represent some of the assets in the city. It's not being created for this afternoon's session, but it has been created with a little bit of thought that's gone into that. So first of all, anybody like to, this is where you can unmute yourselves if you fancy having a shout. Anybody like to name some of the assets there in that very simple picture of Leeds across the bottom of your screen?
So we've got the town hall there, I can see.
Great, yep, town hall. Good, so we've recognised one of it. So you could say that's the sort of almost the civic centre of the city. Anybody else like to have a go? You don't need to put your cameras on, just your microphones. Don't be shy.
I can see Quarry House, I think, there, or the Kremlin as it's known.
Yeah, good. That's with a little space age symbol on top. You're right. That's right. And that was a big asset. I mean, a big coup for the city, wasn't it? Getting a national department to relocate its headquarters to Leeds. Great. Thank you for that. Was that you, Anne?
Yeah, I was just thinking, is that the station, your gateway to the station?
It is on the right hand side. Do they call it south entrance to the station? That's right.
Yeah, I don't know.
So there's the sort of the travel aspect to the city.
Oh, the orange thing. I thought that was the incinerator. It's not though, is it? No.
The incinerator, Toby, which is the regeneration aspect, is just down at the bottom.
Oh yeah.
With the next to the man pushing someone in a wheelchair. Yeah, good. Well done. It's working okay.
Somebody chatting to you as well in the chat. I think.
Oh, I can't see. I can see cameras, my pictures, but if anybody wants to help me with the chats, that's one step too far.
He says the people of the city, which is a brilliant one.
Great, absolutely. Yeah, thank you. Okay, so you get the point. I'm just going to, on the next slide, these are some of the things that the assets of the city, or the picture represents assets of the city. So we've got the station, there's the university in there, the town hall, there's shopping. So I think one of them is the new Trinity, the roof of the Trinity Centre, Leeds Market's on there, recycling, we've had that one, entertainment, I can't remember which bit represented entertainment. I don't know if is the First Light Arena on there. Can't see.
The Grand's on there somewhere.
Ah, Grand, well done. Schools, houses. There is a tree, which I thought might represent green spaces. Industry, and there's a plane flying, so we've got the airport represented. But you get the picture, literally. That what we're trying to say is that in this case, somebody's given thoughts to what are the assets that make people feel a sense of belonging when they look at the city. Okay, so you've now seen quite a well put together illustration. I'm going to show you a less well put together illustration because this is the one we're going to consider for the rest of the digital facility support. Yes, yeah. Okay, here it is. So you may well spot that these are these are not randomly selected, but these are pictures from basically from the free sort of images from the internet. But what we would like to do is we would like to come up with a picture that, in a similar way to the previous picture, which was the assets of Leeds, somehow can represent the digital assets of the city that we are trying to coordinate, to corral, to invest in, to represent the combined requirements necessary to improve health and well-being across the city. So what I'm going to give you now is a bit of a feel for what this represents, but then the idea of the workshop is to say, you know what, you've got your language wrong, the pictures aren't that, you know, what they could be, etc. You're missing some things, whatever it might be. Okay, so hopefully you see where we're coming from. Right, so I'm going to start building this picture now using some words. So right across the bottom, We are, as a city, and this isn't just for health and care across the city, but this is for bringing investment into the city. This is to help companies feel that they want to locate in the city, invest in the city. We recognise that there's a real need to improve and make sure that Leeds is a digitally connected city. Okay. So the premise is, and there's a business case that has had approval and is now at the point of being, what do you call it? Started. There must be a better word for started, but it's been kicked off. And the idea is that all public sector buildings in the city are going to be connected to superfast broadband right to the desktop. So at the moment, you might be aware that there's lots of fibre in the streets, but it generally changes to something called copper that comes to your house or your business, it slows it down, etc. One of the points in the business case was, if we could get Leeds ahead of the game as far as fast connections for the city, it will give businesses maybe a 2 or 3 year advantage from other places to, run digital companies with fast connections. If we connect public sector buildings, it will give us what you might call an anchor point for other buildings that are closely located to those public sector buildings to use that or to sit on top of that connectivity. It has advantages for some of the remote locations in Leeds. Remember, Leeds covers right out to Harewood House, it covers Otley, which might generally be expensive for private businesses to get those connections, whereas we are saying we need Leeds to be a connected city. Now, it's interesting that some of those connections are in the ground, so broadband, fibre connections, etc. But one of the connections we are working on as a city is a technology called LoRaWAN, which actually means low range, wide area network. And somebody gave me this explanation recently. Hopefully it's correct. I have Toby in the room who will tell us if it's not correct. But for those that are old enough to remember, there used to be a radio network called the AM network. So you used to have FM and you used to have AM. And the AM network still exists, and it's ideal for small pieces of data that needs to be moved across the airwaves. And you can imagine that the direction of travel is that we are in a world where we are trying to connect lots of things together. The technical world is Internet of Things. It means that you've got from work, if you so had the luxury, you could set off your robotic lawnmower to cut your grass. You could set off your robotic vacuum to vacuum your lounge or dining room. You could look inside your fridge to see whether you'd forgotten you'd bought a pint of milk. But from a health and care perspective, you can connect lots of things together or to the right people. So you can have devices in your homes that check what the temperature is, whether you need to turn the heating on, whether there's damp in the home, whether there's a flood in your kitchen. You can have things like glucose monitors that could be Bluetooth connected. So as a city, it's really important that we create an infrastructure that allows us to use connected devices to make sure we are able to improve health and well-being. So as an example, as somebody that cares for my mother who's got dementia, last 3 years, it's been incredibly useful to look at the devices that are available as a carer to check on how they're doing, to look at things like, have they got up, have they moved for a few hours, etc. But again, we still take readings of glucose levels using non-digital devices. We write it on a piece of paper in her lounge, etc. These are the areas where we can really start to improve connectivity over the next few years. Okay. Hopefully this is making sense. Just moving up, we've got something around connected essential kits. Over the recent COVID period, it's been really obvious that we haven't got the right kit in the right places. Care homes have been particularly in need of equipment, lots of third sector organisations. There is, problems around what does the public sector fund. It was interesting that Ros mentioned right at the beginning of the need or the possibility of recycling kits, but it's a really important part of our infrastructure as a city. Just moving down that right hand side, what have we got? Well, we've got things like smart buildings. Interestingly, when we first did this diagram, office space was clearly a really important part of the city. Not to say it won't be in the future, but the ability to have all public sector buildings accessible to all public sector services without thinking, well, what Wi-Fi do I need to be on? Have I got the right security? What about even things like passes for buildings, etc.? We need to have smart buildings. But as well, we need to make sure we've got smart homes. So we are in that world of, it's great having a super fast broadband going into your house, but actually, when it comes to it, and you've got all this connectivity going on in the city, what do you want working? Do you want Netflix at high definition, or do you, if that works, does it stop other Bluetooth devices working, etc.? It's a real puzzle. So we need to make sure that we've thought about how do we ensure that buildings can be not only connected, but smart buildings in the future. Going up the right hand side, we've talked about smart devices, but we would like people to have the best devices that are useful to them. Some of it might be a medical device. That picture there of something with a awkwardly shaped probe on it might be for temperature, not quite sure. But there's medical devices, but there are also things like fitness devices. So, your own fitness regime, because what we want to do is we want to keep people healthy as long as possible. When people become ill, or have a long-term condition, we want them to we want them to be able to manage that condition for as long as possible without necessarily going into hospital. And then when people do need care, with health and care professionals, we want that care to be delivered as close to their home as possible. So you can see with that strategy why connectivity is really important. I'm going to breathe because I'm talking too fast and I'm losing I haven't had my lunch yet and I'm just sort of starting to buzz. Right, here we go. So I'm slowing down. Top right hand corner, digital inclusion, really important. So how do we make sure that this digital world isn't going to increase digital exclusion, but is going to increase digital inclusion? So it's a really important part of our city effort. We want to share records. We want to share health records with the people that would like to see their records. Those records could be booking an appointment, looking at a test result, looking at future appointments. But at the same time, we'd also like a world where people felt comfortable sharing their personal information. What's important to me with health professionals. So it could be things such as, if you've got a dog to care for, or you're a carer for an elderly relative. Well, if that's the case, when if you need to go into hospital, those are really important things in your life that others may need to know about. Oh, I'm really worried, I'm anxious because I fell down, went to A&E, I'm now in a hospital bed and nobody knows that I've got or I might have been unconscious for a while. I've got a dog that needs feeding, etc. So this is this concept of sharing information from the health professional to the person, but from the person back to the health professional as well. Something around making the best use of apps. We are in a world where we are inundated with apps. Some apps make great claims for personal health, for mindfulness, for helping you with diabetes, helping you with breathing difficulties. Which apps do we recommend apps as health and care professionals? Do we just let it happen? Do we want to better signpost people to apps that may help them? Do we enable people to use those apps? So that's the one about making the best use of apps. We've got something called clear directories of service. So there is a facility in Leeds called the Leeds Directory. It might take you to health information about, could take you to things like coffee mornings, networks of people that have got a similar health condition. Interestingly, it also takes you where can I get a trusted plumber or a trusted joiner. So it's really important that we have a view on how can we make the citizens of Leeds, how can we signpost them in the way that they trust, rather than just Google search, you know, and you get 1,000 searches. It tells you how quickly that search has delivered its results, but you're no wiser. So clear directories is really important to us. Digital channels, yes, absolutely. Over the last 6 months, the whole experience now of trying to book a GP appointment has totally changed, hasn't it? A digital channel might be the telephone. It might be a face-to-face appointment. It might be, if you've got a nasty skin rash, can you take a picture of that rash, says the doctor, and can you send it to this email address? I'm pointing to my hand, by the way. Rashes, yeah. Yeah, we've changed, haven't we, in the way that we do business as a health service, and as we expect people to interact with the health service. This is only going to increase that need to engage with people through digital channels. We need the information governance to be correct. That means, how do we know that the information that you've put into that app, that did the health service say they recommended this, but now there's been a data breach and somebody else seems to have my information? That's not a good position to be in. So somehow we need to work together on information governance. At the left-hand side, we need to make sure that health professionals that are more than ever working on integrated pathways. So if I've got diabetes, I might go to some, I'll have seen my GP. I might have a district nurse, or in the pre-COVID days, a district nurse calling at my house to give me some injections. I might need to attend a diabetes outpatient clinic. I might have a more serious problem of some, you know, it could be a foot problem that I've got to go to hospital. We need to ensure that there are shared records that are there, that professionals, whether you're in the teaching hospitals, St James's, the LGI, community, your own local GP, practice, we share that information appropriately between those health and care professionals. We've just put a symbol on there. It's Forum Central. You might not know what it is, but it's an organisation that, or one of a couple of organisations that coordinate lots of voluntary sector organisations. These are increasingly important when it comes to assisting with health and care, but also there's a massive gap between the provision that the health service, to a degree the local authority has in terms of digital facilities, and the voluntary sector. But they need to be part of the answer. The bit about wider partner integration was, yes, there's a need to coordinate health and care within the City of Leeds. but more and more, especially for health services, specialist services such as cancer care, they are being coordinated on a regional basis. So Leeds Teaching Hospital will have patients that attend or are under their care that come from, in some cases, hundreds of miles away. They need to be also not disadvantaged digitally because of their remoteness geographically from Leeds. And then finally, at the top, and I think I've covered just about everything on the diagram, there's how we use data across the city. So there are certain things around the provision of what we call open data, data that isn't identifiable to individuals, but actually tells us a lot about the city. So just as an example, think of our 6 months ago position around cleaner air in the city. We had several hotspots. We needed to do something around improving the air quality. That's picked up because there are air quality sensors that monitor data. It doesn't tell you anything about people. It tells you something about the city. Footfall data, transport data, bus routes, etc. All of that is really important to help us understand the city in which we live and the city that needs to have digital provisions that help with health, improved health and well-being. But then there is the data that tells us something about our citizens. Some of it is what's called anonymized, where you just know enough to know maybe the first few digits of a postcode, what the ethnic mix is in a postcode area, what the languages spoken are, what the prevalent health conditions are. So yes, we do know a lot about the health of the city, where the hotspots are around things like diabetes, COPD, breathing difficulties, etc. But again, that is part of the digital picture, that if we do this sensibly, then it should help us as a city prepare ourselves for the age which is already here, which is that digital age. But it is going to rapidly increase in terms of pace and also in terms of choices available to our citizens over the next few years. So what we've tried to describe are facilities, things that, just as we've said, a library is important to someone, a school's important, the transport network's important, the civic infrastructure from our original diagram, we would like to get across, using the right language and the right pictures, that there is also a digital infrastructure that is just as important. By the way, we haven't yet said that there's the money to fund all of this. There is some money, but actually money tends to be more forthcoming if there's a very clear case for the change that's needed. So again, that's one of the aspects of trying to create this picture of the digital assets in the city of Leeds that will help improve the health and care and well-being of the people that live and work in the city. So I've finished my ramblings. I'm just going to stop my sharing for now. Hopefully that made some sense. The idea now is that we have a conversation where you can be open and honest with us about, does the concept work? Have I been talking in a different language for the last 30 minutes that you didn't understand 50% of? If I did, apologies, but that's part of the exercise. Yeah, so happy to move into breakout rooms where you can introduce yourselves and we'll be able to have that more open conversation around, are we on the right tracks? Thank you very much. Okay, so let's just. So I'm Alistair Cartwright. My role is to try and coordinate a piece of digital, programmed digital work across the city, primarily across the health and care organisations, but actually that has a very broad remit now because it includes many voluntary sector organisations that are also involved in improving healthcare and well-being. But from my perspective, it's particularly to look at how can we coordinate the digital efforts to put the right building blocks in place. So that's me. So I'll just so Anne, do you want to just introduce yourself?
Yeah, my name's Anne Arnold. I work for Leeds City Council in the Health Partnership team on the innovation stream, which is quite a long explanation, but that is trying to get digital into health in a way. So my latest project, just briefly, I've been working on an EU project for 3 years using off-the-shelf products, watches, which is quite interesting when you said about 1, your mother, and 2, finding help things around the home. So off-the-shelf products for people over 65. So that's been the latest thing, and also helping recently with a digital festival.
Thank you, Anne. So Marcus, please.
Yeah, hi. I've got a medical device development background. I worked at the Pew for a number of years, and I've worked with a number of other companies in the region. I've been running my own consultancy, which is how I've registered with this event today, primarily dealing with medtech companies and helping them with some of their regulatory compliance issues, you know, in getting the CE mark and filling out, you know, applying with the various levels of technical files that you're responsible for. I've recently joined RTC North, who are funded. I mean, you may well know, but they're funded by Innovate UK and the government to assist companies and organisations in their innovation and growth. And one part of the funding was definitely to overcome some of the challenges faced by COVID. As much as COVID seems to be a great catalyst to the transformations that are taking place, as much as in healthcare and whatever. So the RTC North are a team of generalists, by and large, with specialists in all sorts of different areas, in sort of manufacturing, marketing, different sectors. And I happen to be, there have been other people in that sector knowledgeable about healthcare, and I'm one of the people there at the moment who has a good understanding of medtech but also its interrelationship with healthcare. I've worked with some digital health businesses.
Right, thank you. Thanks, Marcus. Welcome, Grace. Hello. Do you want to just introduce yourself, Grace? I'm not getting any voice. Right, you're on mute. Yep.
Okay, great.
There you go, perfect.
I'm Grace Feeney. I'm a project development worker. I work for Leeds City Council and also Lincoln Leeds. I only started last week, and my role will be covering South Leeds, addressing health inequalities across the priority neighbourhoods.
Great.
And there's because of COVID, a lot of how we would have worked is changing and focusing on trying to connect with people digitally. But I'll be quite well connected. Eventually, I'll be connected with local GPs and third sector organisations and the community groups, and looking at getting sort of like health champions in the communities to help us find out what it is that they need and deliver that for them. So that's going to be my role.
Perfect, thank you. A strange time to join, but I'm sure you'll get there.
Yeah, thank you.
Yeah, Molly, please.
Hi, I'm Molly. I'm just in this breakout room as tech support.
But we welcome your input as well, Molly.
Thank you very much.
Molly.
Yes.
Molly, I think your input would be really useful, actually.
Okay. Yeah.
Because Molly's got a bit of an events and management and marketing background, and I think this is one of those. I think it's an important element of what we're doing here. So, yeah, let's make the most of you while we've got you.
Absolutely, yeah. Nobody gets a free ride on this one. Ros, please.
I work for Habitat, and we're a digital, well, as I said at the beginning, but I think Marcus has just popped in now. We're a co-design digital inclusion and innovation team, and we're hosted by the NHS in Leeds. And we do all sorts of things that I won't go into now, but we've got a website. And I think I have been blown away by the amount of stuff I knew would be that you've just presented, Alistair. It's so complicated and so, comprehensive, and I think that's the big issue here. How do we translate that into something that people can really understand, navigate, and get the best out of, and know what's happening to them, and feel in control of it all, and have a bit of power over it, that kind of thing. So. Right,
thank you. Thanks. Just out of interest, Marcus, what's your connection with Leeds?
Well, Leeds. I live in Boston Spa, so I'm very close.
All right, yeah, good, yeah.
And RTC North have an office in Leeds. On Kirkstall at the tannery there. And there's now 15 of us there, so there's quite a resource. And with quite a range. I mean, there's 70 to 90 in the whole organisation now, from Sunderland through to Daresbury and the Northwest. So they, in principle, we are a resource that companies and organisations, and they can be not-for-profits, if they are looking at commercial challenges and issues around strategy, it's fully funded time with people who've been through the mill, basically. And we're finding with quite a few organisations that can be, we're at a pinch point where you need capacity. We can come in and provide some extra reflective resources and some research tools as well. So.
Yeah, okay, that's helpful. So I'm just going to very quickly, particularly for Marcus's benefit, because who didn't catch, because we do need to understand what the task is. I'm going to just put my screen. I'm just going to share my screen again, if that's okay. So this is the task. So I recapped on the fact that this is just an example of pictures of a place often create a sense of belonging, so you'll be able to look at that and say, oh yeah, I recognize such and such, and I've been there, and my family works there, whatever, I've been shopping there. And this backdrop to this PowerPoint slide is just a fairly well created graphic of assets in the city, things that make a city, transport, people, green spaces, shopping, civic centres, and so forth. Okay. But what we're trying to do, and I spent the most of the time looking at a less elegant picture, but we really would like to come up with an illustration of how the digital facilities, if corralled in the right way and invested in the right way, would help with people's improved health and well-being. So it goes right from at the bottom, infrastructure. Again, is probably a language that people don't immediately relate to, but networks, connecting things up. How do we look at smart buildings across the city? How do we make sure there's the right kit, including in the voluntary sector? How do we make sure that people have as big an opportunity as possible to be digitally included, skills, access to networks, etc. Shared records, both among health and care professionals and members of the public to health professionals and vice versa. Signposting people to apps, services in a way that's reliable, and not just let's do a Google search and hope for the best. Smart devices, again, how do we make sure that it's the right devices for the right purpose? How do we test the devices? How do we make sure that you don't get 50 devices in your house and your network collapses, and etc. Digital channels have been very important, remote consultations, face-to-face, telephone, and so forth. So the task for us this afternoon in the next maybe 15 minutes is, does the concept work? Have we got the language rights? What about the imagery, which I have shamelessly just pinched off the internet just for the purpose of making the point? What about the content? Are we missing things? And what's the audience? Nice little idea, but actually what I'd like to do is I'd like to use this to help people see the join between facilities, digital facilities, and improving health and well-being. So those are the headings: concept, language, imagery, content, and audience. So it is there's not many of us, which is fine, which is a good opportunity for it to be, shout up, give a view under any of those, and I'll try and put them under those headings. So starters for 10. Have we got the concept right? Does it work?
That comes back to the audience, doesn't it?
Okay. Yeah, good point. So audience and context, or concept. Yeah, good point, Anne.
Who are the audience? Like the members of the residents of the city?
It definitely needs to resonate with. So if I might. So this is what I've got in my head. If just as I was, we want people to be happy about the city they live in, they work in. We are trying to create neighbourhoods of people that feel that they've got a common set of values or interests, etc. Almost if I was to say this is the Welcome to Leeds pack, just as getting a map of the bus routes, and here are our connected digital, here are the digital facilities that we are trying to create as a city to improve your health and well-being.
I think that end users, or let's say normal citizens, would maybe look at that and think, how does that relate to me?
Yeah.
And I'm speaking from the point of the work that I've been doing with, as I say, the group of over 65-year-olds, and then that went down to 60-year-olds, and going out there and getting their view on digital and how they perceive the city and their way into services. We're going more digital, which is fine, but at the same time, it's pitching it right for the audience. So it's always going back to that, as I started with, the audience, but someone moving to the city.
So do you think it needs a sort of, we would call it a sort of a use case for different groups to say, how would I use these facilities? What difference would these facilities make to me if I was over 65? Do you think that would help?
Yeah, well, not necessarily that. I'm just speaking from that point of view because, like yourself, I've been a carer. So, that is also quite important, that people who are accessing things on behalf of other people, that they know where to go. So do you need something that it feeds into, like a second layer maybe? I don't know.
Good point.
To show the services that sit within that. What does it actually mean?
Yeah, thank you.
Where I would start with it all is with what matters to people. So it reminds me of some stuff we did with Sheffield Flourish, and we had some money to do a digital thing, a platform, and it is for people living with mental health conditions. And what we did was got a few people into the room, some of whom had expertise by lived experience of mental health and some digital and so on. And we just started with, actually, what do you need to live well? What matters to you? And it was really interesting because I was the only person that talked about medication, and that's because I've got type 1 diabetes and I die without insulin, and nobody else did. And other people, and they talked about things like, sense of community and feeling purposeful and all those things, and healthy lifestyles and stuff. But so I always think with something like this, you kind of got to go, rewind a little bit and get into the, this is what co-design is all about, isn't it? About creating empathy and say, actually what does matter to you? And then our job is then to translate this lot into that picture, as opposed to starting here, I think. And I think actually when you were talking earlier, I could hear some of that. You know, when you talk as a carer, as you know, someone you talked about diabetes and so on. You know, you can. And when I'm looking at this as a person living with type 1 diabetes, I can translate and it's that picture I need to get, I think. So, and I wondered about, I know that there was some work done a while ago around personas, and I wondered whether you could sort of do a bit of work around working with people to create some sort of personas, and then how you translate this is through stories. And then the other thing is, I was going to ask you, do you have to, you know, we're talking about digital, so we can be a bit more creative in having a 2D picture. You know, can we have a sort of a thing that, you know, you press on it and there's someone from Leeds telling their story about
that's really interesting.
Can we be creative with it? I'd love to hear, even if it's just voice.
No, that's good. Sorry, I'm just finishing writing things on my digital notepad here. That looks very like real paper. No, excellent suggestion. Yeah.
I was actually gonna, the thought I had around visually was very much person-centered as well. I think when a person thinks about what they want or need, they often think about themselves. So I don't know, I guess, how if you're going to get somebody in to make it look appealing. Like an artist or something. But the idea I kind of had was like a person in the middle with like, you know, almost like underground is like the wires, and you know, the kind of the connection that you were talking about. Fiber, whatever you call it. And then also connected, the person being big enough to be connected to a cloud above their head, which then is a digital cloud, obviously. And that could tie in with being different things around that person, whether it be equipment or a building. And it could be like Ros said, where they would click on the object or the whatever, you know, the item on the picture that would then tell them more about that, rather than it being too wordy on the initial page or whatever it's on. That's just, I work very visually, so
that's really helpful, Grace. Thank you.
Can I
Marcus, please.
Just quickly, this is so brilliant that I've known a little bit of the digital community over the last several years in Leeds and been really inspired by it. And I've got to drop off the call because I have got something else to go to. But Alan Davis was running a B2B marketing session this morning, and in his presentation, he spoke specifically about how brand development can be tailored to the audience. And I think what you're showing in this image here is how rich the foundation is within the community. And there may well be within the digital community some people who know how to respond to what you're talking about. And then according to how you engage with the model, you then may well get different information that's targeted towards you. I've got to go. I'm so excited about this. Please get in contact, because I think there's a lot we can do.
Thank you, Marcus, for your input.
Very much
appreciate
indeed.
That.
Really tremendous. Thank you.
Okay, I mean, that's some useful, some really useful feedback there. So concept needs to vary with the audience. We've had a bit about imagery. Anything on are there anything you'd expect? I know it might not be pictured in the right way or written in the right way, but anything you would have expected to see included? Ros, have you got anything?
I don't know, because I was like half and half about, obviously, you know, thinking about Habitat. And I think more like, so you have got some infrastructure stuff there, like West Yorkshire and Harrogate Health and Care Partnership, which is meaningless to everyday people, and probably Habitat is as well in that sense. But there's something about you know, the things that come out of it. So I think Mindswell would feel really tangible and really important to people, and it's a generic thing that we want everybody to know about and use and make the most of. So, you know, you talk about city assets. I think they're important to have here, because you can get hold of them and you know what it is. And everybody, well, to certain degrees, people know the word mental health, and then they would know where to go. So there's some stuff which needs to sit at the back, and some stuff which needs to come forward according to what matters to people. The other thing I was thinking of is the way I was thinking, what are you trying to do underneath all this? What is the point of all this? And I think it's about everyday. You said people feeling happy about where they live and being able to sort of make the best use of all of this. And there's lots around this picture. Will need to go some other stuff, and I think Grace might have some of the stuff for you. So years ago, I worked on a community health champion program, and we trained 17,500 people, and they went out into their communities and they supported 100,000 other people, and they are the magic in all of this. Those people are the magic, and it's like, how do you work with people to spread this message? It's like you need to do your branding and your messages, and then you have this as an asset, but then you're able to sort of push it through all these fantastic community infrastructures that you have. And it's fortunate that you've got Grace on here today, actually. I think she might have.
Yeah, and she's obviously appreciated that plug for.
Yeah, I do think it's all about people, isn't it? All this stuff is all about people.
Yeah.
And I think there's just a sense that if it's going to be about digital stuff, you've got to make it digital. You've got to do something dynamic.
Yeah, no, it's a very good point.
And I liked what Marcus was saying about, actually there's some really creative, brilliant people around. And there are, if you did a competition, if you went, this is what I want, here's the brief, come on City, chip in. I bet you'd get some fantastic free stuff.
Yeah, interesting.
People want to. Everybody wants to do something to help, don't they?
Yeah, especially at the moment. Yeah.
And I mean, one of the other audiences is so Marcus was saying, he provides input to things like smart devices, and knowing where a smart device manufacturer can understand the bigger, that's how I fit in, and there is an interest in the city in good smart devices, just it could engage our sort of business partners as well.
Digital marketplace, isn't it?
Yeah. Okay.
Can I say something as well? One thing that really sort of not worries me, it's just a thing that I'd love us to get right, is about power. And I think people give away power so much with digital health stuff. And it's like, there's a lot of valuable information and all that sort of thing going on in all of this, isn't there? And it's like, how do we sort of collectively make sure that people understand what's happening and benefit from it collectively as well? So the whole idea of data trust and all those kind of things.
So and, just expand on that then. So by power you mean the power of what, our assets, or being in a.
So because I feel often in digital health and even in co-design, often everyday people don't feel powerful in this picture.
Yeah.
Being done to, or they don't understand it. They don't feel like they've got choice and power over stuff that's going on in their lives. And actually, you could turn that around. And also, I think that I mean, this might be a bit political, but I think the money side of it's being wringed out, isn't it? And we lose it once we do that. And actually, there's something about doing something collectively that then invests in the city.
Yeah.
Maybe another layer of all this altogether. Sorry, gone off on tangent. Sorry.
No, it's really helpful. So it looks like we've probably only got about a minute left. So anybody wants to, given that this is you giving your views, anything else anybody wants to throw in? Okay, so I'm going to stop sharing my.
One thing, sorry.
Please, please.
Just what Roz said about consulting the people, I think is a really good idea. Just that.
Yeah, thank you, Grace.
A lot of what I'm hoping to do is going to be through consultation with people, because I think if you don't, then you might learn the hard way that what you've created is not right for everyone.
Yeah, no, that's really good feedback there. Okay, so feel free to, if you press leave the room, then you'll be in the back in the main room, I hope.
Sure, we liked it. Well, it kind of represented a bit of, I think, transient nature, and maybe a kind of we're kind of an aspirational. These are some of my opinions, actually, but I only get to say this in certain. So I'll say it anyway. So we want it to be more part of the everyday rather than a kind of roadmap of a fictitious future. Maybe it was mentioned near the end that we won't engage people if the language is inappropriately technical. There was also questions around what's this telling me, what's this trying to get across, and try and give something people to relate to. What does it mean to you? What does digital healthcare mean to you? And if you start with something familiar, it will help you get them on a journey and bring them along with you rather than So that's my summary.
Excellent, thank you, Toby. Very helpful. Anybody from that group like to add anything, a perspective that has been missed? Pauline, was that a thumbs up, or is that just a general thumbs up? Okay, good, thank you. So be assured, we are going to use this to create something, but I think our thinking has been, certainly from what I heard at our group, it has been really informed by the conversation this afternoon. I'll just summarise some of the feedback from my group. Now I'm going to put, here we go. I've just put screen share on. Can you see my screen? You can see why I'm embarrassed with Toby's high-tech solution. But it's good feedback, because next time I think we'll have to use those techniques. So we went through we started off by, was the concept right? And actually we then decided, well, the concept does depend upon what the audience was. So a bit of debate there around what the audience, who the audience is. And it's almost what we've tried to present, you could view as sort of background or foundation facilities that therefore by definition are mean something to lots of people, but don't mean a lot to specific people. So we then went down the line of, actually, to make this mean something, we're going to have to somehow tailor it to certain groups. Almost what of that matters to me if I was whatever it might be, if I had a certain condition, if I was in a certain age group. And I know it's sort of pigeonhole a little bit, but we have done quite a lot of work in Leeds around something called personas. So a young, fit and well person might be a type that we need to say, well, what would it mean to you, these facilities, which might be very different to a different audience. We talked about trying to use it to somehow create empathy, understand someone's situation and how these facilities might help. We then started to look at the fact, well, actually, if this is about digital, really we need to up the game when it comes to creating something digitally that would represent this picture. So we talked about, does it need to be 2D? Could you have something that you clicked on and it took you to more information about one of those facilities? Or it could be that you could start with the persona of the group of people, and it tells me more about somebody living with type 1 diabetes. And again, you've got the same foundation illustration, but you're making it more meaningful to individual groups. Certain things that we felt weren't meaningful. Things like, West Yorkshire, what does that's almost you've got to be in the service to understand what the significance is of a West Yorkshire partnership. We talked about actually at the end of the day, it's people that are going to make this digital vision stick. So we talked about community champions, and if we worked with them to sort of form the next phase of development of this picture, and then they championed it within their local area, then it might be the same or similar illustration, but you've got that local meaning put around it. And also there was something around, at the moment, we've just got general headings like apps and shared records, but actually we've actually got assets, products. Ros mentioned the one, we've got a product in the city called Mindwell, which is a signposting app for people with mental health. Do we need to be more specific about the facilities that actually exist rather than the concept of better signposting? So it's really helpful, really helpful. Anybody from our group want to chip in? No, no worries. So hopefully we've, what was our purpose? Our purpose for this afternoon's session was for it to be twofold, to get a group of people together who would understand a little bit more about the facilities that we were trying to create in the city of Leeds for the citizens in Leeds and for those people that have businesses in Leeds, etc. And we were trying to get across to you what those things are, and you might have had certain interest areas flagged up, certain in areas where you might say, well, could we have a bit more information? Could we make some contact, exchange some mutually helpful details around that? Second aspect was we fully acknowledge that we've got a very crude concept of a graphic, a picture, to try and show how these things fit together. Because oftentimes people are working in one of those particular areas. So there was a gentleman in our group that was working in the area, he's had to leave now, but working on the area of smart devices, connected devices. So, it's so easy to go down that level of detail about, oh boy, this works brilliantly, but does it work brilliantly in the context of all the other assets in the city? So it's that sort of connection we were trying to create. And what we've now ended up with your input, is a whole load of suggestions about how we can get this concept across, how we can use the right imagery, the right language, how we can be more sensitive to audiences rather than just here's an audience called Leeds or citizens of Leeds. I found it really helpful. Toby, hopefully similar from a sort of city team, and Natasha, who's been supporting us as well. But anybody, any final comments anybody wanted to make? I don't want to sort of, spin this out longer than it needs. Ros, please.
I just wanted to say, I think that there's something about a question for you about how do you tap into the rich sort of knowledge and skills and talents that we've got in the city around actually co-designing this. And I'm not actually talking about Habitat, although we could have a part to play. But I mean, we've got these brilliant sort of creative people, people who do animations, who do all sorts of fantastic stuff. And then we've got people like in our group, we had Grace, who's engaging with people in communities. So we've got that stuff out there, and it's like the challenge is how can you mobilize all of that lot to get you the right sort of end product. And I sort of suggested, because we did something like this, a sort of competition once a while ago in Sheffield, where we said, what do we need to make this city a more mental health friendly city? And we ran a competition, and we did have a prize at the end of it, but nobody was really particular. Someone gave us the prize back, the winner, the money. Yeah. So they didn't really want that. They just wanted to contribute. And I think if you could tap into that, we want to help our city vibe, you might get some really interesting way out there, and really, maybe some doable ideas.
Yeah, I think it's a great idea. And I think, to be honest, Ros, what it's making me, so Leeds is a big city, 780,000 residents, loads of voluntary sector organisations, lots of businesses, etc. And it's how do you create frameworks in which you can have these dialogues? So in the past, I know we have had what we called innovation labs, where we brought together a set of people that were digital specialists, and we presented a problem, and we brought people there that could represent, almost a bit like a debate, both sides of the problem. But in the scale of 780,000, it's tiny. Some good things have come out of it, but it does feel that and Ros, you and I have talked about that, those that have a role in, because there are a number of roles that are about trying to coordinate certain features of the city. So we've got one that looks at estates for the city, buildings. We've got somebody in the council that looks at inward investment. We've got somebody like me that's looking at digital. We've got people that are looking at workforce and engagement. And it feels like we need to almost co-create again an approach to, how might we better engage? Or are there things that are great at engaging for one subject, but are not aware of another engagement method for a different subject?
Yeah.
So welcome that idea. And I think a competition's good. And again, but where do you put it? Who do you get involved? Who do you test it against? Yeah.
I can see a lot of nodding from Pauline. I think Pauline should be involved. I think, you know what I mean? You could get a citizen panel, the people that
definitely
want not just, I mean, people in different things, places, backgrounds, and all the rest of it together that have got to be the audience for this. That they and then you run, you develop a brief together, put it out there. I mean, yeah, it's a bit of a faff, isn't it? And it depends on your resources and how long you've got and all the rest of it. But what it might do, because I think part of what you're trying to achieve, you will achieve in the process rather than the end product.
Yeah, good point.
It happened to us just now, didn't it? All of us, we've just learned a load of stuff. Like, I didn't know all those things, and my head was going, like that, and we'll have all been doing that. Just by having this conversation, you will have achieved some of what you want to achieve, like even without the picture.
Yeah, definitely. Yeah,
So
and I think it also
it
also illustrates that it needs a combined set of skills. So I know stuff about technology, but clearly not a lot about making a picture, or about engaging with people, and to be fair, about co-production. So I think it does need that combined set of interests and skills that could make this more useful.
The other thing is I always think go where the energy is, and this group of people turned up today, so maybe this is your starting point.
Yeah, that's a good point. I'm going to write that down on my paper.
Two things: one, go where the energy is, and two, look for the small actions that will make a big impact. I live by those.
Yeah, great. I've written those down. Small actions, big impact. That's good. Okay, well, thank you. I do appreciate people's time. Hopefully you've learned something as well as contributed something. And it was, I think the breakout session seemed to work well. People spoke freely, which was really great. So all that remains is me to say thank you. But Ros, do you want to say any closing words?
Oh gosh. I have
It could just be thank you.
My closing words, I really enjoyed that. And actually, we did have quite a low dropout, but I really enjoyed having a proper, decent conversation where everybody could contribute. And quite a lot of the events we do, there's tons of people on it, and you don't get that quality. So I've really enjoyed that. I really enjoyed learning about the city. And I enjoyed I've made some, I think I've made some new connections, and I learned about Grace's work and Marcus's work. So absolutely brilliant. So I hope everybody else felt the same. But we should clap you. I'm going to clap you now. There you go.
We can clap each other, can't we? Very good. Okay, well, thank you very much. And in terms of the recording of the session, what was the plan with that, Ros? Is that just...
It's up to you. We can share some or all of the session on your website, our website, whatever. So if you just get in touch with Gemma and tell her what you would like.
Great.
As long as it all went well. It depends. We'll have to check the recording and make sure it'll, you know, because sometimes hiccups and things. But yeah, it all went well. Nobody swore and all that sort of thing.
Not in our group anyway. I can't speak for Toby's.
Possibly.
Okay, thank you everybody.
Thank you.
Cheers, everyone.
Bye.
Take care.
Thank you. Bye.